Hi, welcome to Healing Tunes. Please watch the video. Tennis elbow, lateral epicondylitis, is a painful condition that occurs when tendons in your elbow are overloaded, usually by repetitive motions of the wrist and arm. Abnormal tension in the forearm muscles that attach to the lateral epicondyle at the outside of the elbow. For almost half of all recreational tennis players, tennis elbow is anything from a nagging and persistent pain to a crippling disability, more properly known as lateral epicondylitis. Tennis elbow is the bagged which goes with an otherwise wonderful outdoor sport. This pain and swelling around the outside of the elbow can be so severe the only answer is to stop playing. It also tends to affect men more than women. While the term tennis elbow is the generic description for this pain at dysfunction, the same problem happens to many gardeners, bowlers, housekeepers, carpenters, mechanic, and even briefcase toting businessman and woman. It's basically referred pain or tendinitis stemming from repetitive overloading of muscles in the forearm, upper arm, and shoulder. These muscles include the supinator, brachioradialis, triceps brachii, supraspinatus, wrist and finger extensors, anconeus, a tiny muscle which help extend the elbow. Among other actions, these muscles help anchor the arm during tennis strokes, as well as gripping or twisting the racket. When tennis elbow is severe, the impact of a volley and overhead smash is unbearable. Pain is generally felt in or near the lateral epicondyle, whether it's caused by true tendinitis or referred pain. This condition mostly forearm muscle trigger points cause the mimic the tennis elbow. First muscle is the supinator. Primary referral pattern is into the lateral aspect of the elbow with spill over into the dorsal part of the thumb. Next muscle is the brachialis. The main referral is into the thumb with secondary pattern in the anterior arm and entire elbow joint. Next muscle is the brachioradialis. Lateral elbow, forearm, and web of thumb. People usually forget that this muscle is an elbow flexor because it lies over the forearm and attaches way out on the styloid process of the distal radius. Next muscle is the triceps. The long head usually refers pain into the posterior shoulder and sometimes down into the posterior forearm, skipping the elbow. The trigger points in the center of the medial head refer into the olecranon process, the elbow. Trigger points in the lateral part of the medial head refer into the lateral epicondyle and are common component of tennis elbow. Next muscle is the supraspinatus. The primary referral is a deep ache in the mid deltoid area with spillover down the arm into the elbow. Next muscle is the pectoralis major. The sternal head refer into the chest and medial aspect of the arm. Next muscle is the extensor carpi radialis brevis. Trigger points in this muscle refer to the posterior wrist. This is one of the most common myofacial cause of pain in the back of the wrist. Next muscle is extensor carpi radialis longus. Trigger points in this muscle refer primarily to the lateral epicondyle. Secondary referral can be in the anatomical snuff box between thumb and fingers. Spillover referral is down the posterior arm. Next is the extensor digitorum. Trigger point refer pain into the middle or second finger with spill over down the dorsal aspect of the arm. Trigger points in the middle finger extensor are the most common. Trigger points in the ring finger extensor also refer pain into the lateral epicondyle. These muscles are vital to the gripping motion because the wrist extends during the grip, increasing the grip power. Next muscle is the extensor carpi ulnaris. Trigger points refer into the posterior ulnar side of the wrist. Next muscle is the subscapularis. Primarily refers to the posterior shoulder with spill over into the anterior medial arm and both side of the wrist. Next muscle is the anconeus. This is the small muscle. Trigger points in this muscle refer to the lateral epicondyle. Anconeus is small and thin muscle. This muscle also is rarely injured. Static pressure to the muscle belly with a finger point while flexing and extending the elbow is an effective and safe way to soften the muscle and release any trigger points. Please subscribe the channel, like the video and share it. Thank you for watching our channel.